Welcome, future nurses. Let's jump right into this explainer, which is designed to serve as your ultimate study guide for our upcoming NSG 331 Healthy Aging Quiz. I am so thrilled to guide you through this material. As your faculty, my goal today isn't just to help you pass a test, but to truly prepare you for the real-world scenarios you're going to face at the bedside. We're taking the core concepts from your course materials and distilling them all right here.
Before we dive into the data, I really want to anchor our review with this beautiful thought on the profound human impact you'll have at the bedside. As Maya Angelou so perfectly put it, they may forget your name, but they will never forget how you made them feel. You know, when we talk about gerontological nursing, we are talking about a specialty deeply rooted in holistic, compassionate care. It's about healing the mind, soul, heart, and body of our older patients.
Okay, here's our roadmap for today's review. 1. The aging imperative. 2. Key aging terminology. 3. Global demographics. 4. Confronting ageism. 5. Healthy people 2030. And finally, 6. Clinical judgment.
All right, let's start with Section 1, the aging imperative.
Here is a quick Socratic knowledge check directly from your course materials to test your baseline. Which statement identifies a predictive trend regarding the healthcare needs of older adults? Think about what we already know regarding our aging population and the intense demands on the healthcare system.
And the answer is, we urgently need more nurses educated in older adult care. Why? Well, because clinical practice sites are absolutely no longer limited to just acute care or nursing homes. You'll be treating older adults in community clinics, home-based care, and case management settings. The sheer volume of older adults means that no matter what unit you end up working on, you are going to be a gerontological nurse. Moving right along to Section 2. Key aging terminology. So the absolutely crucial point here is drawing a hard line between gerontology and geriatrics. Gerontology is the broad, holistic, scientific study of aging. It emphasizes wellness and looks at the complete biopsychosocial needs of older adults. On the flip side, geriatrics is specifically focused on the medical care and treatment of the ill elderly. As nurses, our scope heavily embraces gerontology because we're constantly striving for wellness even in the presence of chronic illness. Next up, make sure you can differentiate senescence from senility. Senescence is simply the natural, biological process of aging and deterioration. It's just what happens to our cells and our bodies as the years pass. It's completely normal. This is vastly different from senility, which is an outdated and frankly inaccurate term, often incorrectly used to describe cognitive decline. And remember, cognitive decline is not a guaranteed or normal part of the aging process. Now, there is a massive difference between chronologic and biologic age. A patient's chronologic age is literally just the number of years they've been alive, categorized into brackets like young old, or elite old. But their biologic age, that's the actual physical condition of their body, which is heavily impacted by their individual lifestyle, genetics, and environment. Think about it. A chronologic 80-year-old who walks 3 miles a day might have a much younger biologic age than a chronologic 65-year-old with a lifetime of smoking and poor nutrition.
Okay, Section 3, Global Demographics.
The volume of our global demographic shift is, well, it's staggering. By the year 2050, the population aged 65 and over is projected to exceed 1.5 billion people worldwide. To put that into perspective, you're going to be practicing in a healthcare system where older adults make up a massive percentage of your patient load. The silver tsunami isn't coming, it is already here. Furthermore, we're looking at a vastly more diverse population. By 2060, people of color will comprise close to half of the U.S. population ages 65 and older. This means your culturally competent clinical judgment will be an absolute necessity. You've got to be prepared to honor different cultural views on aging, family roles, and end-of-life care. Let's break down where these patients actually live. It's a really common misconception that most older adults are in nursing facilities. In reality, only about 5% of all adults 65 and older live in nursing homes. However, if we look specifically at the population within those facilities, notice how the demographic dramatically jumps. 55% of nursing home residents are 85 and older. As medical technology extends lifespans, we're seeing a compressed morbidity where individuals live independently much longer, but then require higher acuity care in their elite old years.
Which brings us to Section 4, Confronting Ageism. Ageism is a pervasive prejudice based literally just on a person's age. It's a bias that can be driven by society, by healthcare professionals, and honestly, sometimes even by elders themselves who internalize these negative stereotypes. If you assume a patient is confused simply because they're 85,
or if you catch yourself speaking to them like a child, you are participating in ageism. Your clinical judgment must always be rooted in assessment, not assumption.
Now, ageism often stems directly from gerontophobia. This is an abnormal fear of being around elderly people, or a deeply rooted fear of one's own aging process. It's a psychological barrier that can totally prevent healthcare workers from providing empathetic care. You must actively confront any personal biases or fears in your clinical practice to ensure you're treating the patient in front of you with the exact dignity they deserve. All right, Section 5, Healthy People 2030. These specific Healthy People 2030 objectives act as your target goals for disease prevention in the older adult population. When you're doing discharge teaching or community health assessments, your clinical focus should heavily prioritize reducing risks related to dementias, preventing falls and injuries, managing osteoporosis, and addressing sensory and communication disorders. This is exactly how we push population health forward. Okay, let's test your grasp of wellness within this holistic framework with another actual quiz question. Read this one carefully. Select the statement about wellness that best applies to a patient who is terminally ill with end-stage cancer. How do we apply a concept of healthy aging to someone at the very end of life?
You absolutely must remember this critical nursing concept. The patient has the right to define wellness for themselves. Wellness is not simply the absence of disease. For a terminally ill patient, wellness might mean adequate pain control, spending quality time with family, or achieving a sense of spiritual peace. It's defined by functional ability and the patient's own holistic point of view. Finally, let's bring it all together in Section 6, Clinical Judgment. To assist older adults in achieving their highest possible level of wellness, your clinical judgment has to follow 3 actionable steps. First, you must empower the older person. For example, celebrating that they can dress their upper body independently after a stroke rather than focusing on what they can't do. Second, aggressively use available resources. Get Meals on Wheels arranged or set up grab bars with physical therapy before discharge. And third, collaborate with the person and their significant others. Remember, it is a partnership, not a dictatorship. Ultimately, gerontological nursing is really all about human connection, resilience, and recognizing the potential for optimal health in every single patient interaction. When you hold your patient's hand, you are translating all of this data, all of this science, into compassionate, evidence-based care.
I'm going to leave you with this final, provocative thought to ponder before your quiz. In what ways can you utilize therapeutic communication to empower the older adults you will care for? How will your specific choice of words, your active listening, and your bedside presence actually build the bridge to their wellness? Think deeply about that. Study hard, trust your knowledge, and I will see you in clinicals.